Here at UConn Health, we are here to support you and your baby, regardless of your feeding choices. We are here to provide you with up-to-date, evidence-based information so you can make an informed decision while feeding your baby. Breast milk has amazing benefits for you and your baby. For babies, it's obviously the best nutrition because it is made by a human being for a human being. The proteins in breast milk are very, very easily digested in your baby's tummy. Providing breast milk to your baby also drastically decreases their risk of developing an ear infection, sudden infant death syndrome, obesity, and some childhood cancers. The benefits don't stop at baby. By providing breast milk for your baby, you as a mother are helping your health as well. Breastfeeding mothers have a lower risk of developing breast and ovarian cancer. You are also decreasing your risk of developing high cholesterol, diabetes, and heart disease. What's a great way to get breastfeeding off to a good start? Skin to skin. Skin to skin is a great way to get to know your baby and facilitate bonding. Immediately after birth, your baby will be placed on your bare chest. This is commonly referred to as the golden hour. Skin to skin will help calm your baby, soothe your baby, lead to more frequent feedings at the breast, which improves your milk supply. Skin to skin also helps regulate your baby's temperature, your baby's heart rate, your baby's respirations, and your baby's blood sugar. Skin to skin is medicine for both you and your baby. Also at UConn Health, we practice and encourage the act of rooming in with your baby, 24 hours a day, 7 days a week. Studies have shown that the act of rooming in, keeping mother and baby together, facilitates more frequent feeds as mom learns her baby's individual feeding cues. This results in feeding the baby on demand. This can lead towards a greater, more plentiful milk supply. When should you feed your baby? Short answer, all the time. Babies cannot communicate their needs with words. However, they're born with innate abilities to demonstrate hunger. Rooming in allows mom to recognize these hunger cues, which results in feeding your baby on demand. In lactation, we say, watch your baby, not the clock. Aim for 8 or more in 24. Early feeding cues can sometimes be very subtle in nature. However, this is oftentimes the best opportunity to offer the breast to your baby. These cues can involve sticking out their tongue, smacking their lips, fluttering their eyelids, and starting to stretch in their bed. Crying is actually a late hunger cue. Just be mindful and aware that your baby might need a few moments to calm them down before they can readily attach to the breast. Skin to skin is a fantastic way to accomplish this. Holding and positioning your baby at the breast is important in order to achieve a comfortable, deep, effective latch. This can be accomplished best utilizing the acronym CHINS. C is for close. Hold your baby as close to you as possible, avoiding any gaps. H is for head tilt. It's best if your baby is permitted to allow their head to tilt back a little bit, pushing their chin to the breast first, hence the acronym CHINS. We want them to lead to the breast with their chin. I is for in line. Just ensure that your baby is lined up properly. An easy way to check this is their mouth and their belly button pointing in the same direction. N is for nose to nipple. It's best to align the nipple towards the roof of your baby's mouth to enable them to reach up and achieve a deep latch. And S is for you, mom, sustainable. Make sure you're comfortable. Prop yourself with pillows. Have your phone within reach, and definitely don't forget the water bottle. Breast milk has all of the nutrients that your baby will need. And feeding your baby on demand will ensure that your supply continues to meet the needs of your infant's growing tummy. Often during the first 24 hours, your baby may be quite sleepy and difficult to arouse. This is normal. Hand expression can be an incredibly useful way to accomplish two very important tasks during this sleepy time. Number one, it provides your breast with that frequent stimulation that's necessary to help increase your milk supply. And number two, provide a small amount of colostrum to feed your baby. This can be accomplished with either a small cup, a small oral syringe, or even a spoon. Contrary to the sleepy birthday nap for the first day, your baby can be expected to be much more wakeful during its second night. Second night syndrome may include your baby waking to feed very frequently and cluster feeding with only short periods of time between feeds. This is normal. They are working to help initiate and increase your milk supply. Don't forget about the importance of skin to skin during this time. To help get off to a great start, ask your provider about antenatal hand expression. We have pre-assembled kits available in each of our outpatient offices. Learning how to express colostrum can give you and your body a jump start for when the baby arrives. This colostrum can be collected and stored to have available if the baby needs it. And don't worry, every single drop of colostrum that is expressed from your body is replaced, so you're not taking away any food for your baby when they arrive. You'll have plenty of liquid gold. So what about formula? Introducing formula when it is not medically necessary can actually lead towards a decreased milk supply, and this can greatly alter the gut flora or microbiome in your baby. If your baby requires any additional supplementation, consider pumping or using hand expression and providing that expressed colostrum to your baby. How long should you breastfeed? The American Academy of Pediatrics and the World Health Organization both recommend and encourage exclusive breastfeeding for your baby's first 6 months of life. At 6 months of age, complementary foods are introduced, but breast milk still makes up the majority of your baby's nutritional needs. You should continue to breastfeed on demand as long as mutually desired by both mother and baby for up to 2 years and beyond.
We will talk to you about your feeding preferences during your prenatal care, starting in the first trimester, and then we will continue to address this with you as you progress through your pregnancy. In the postpartum period, if you are having any issues with breastfeeding, we can refer you to our lactation consultant who can meet with you and your baby to work on any breastfeeding problems. Here at UConn Health, we recognize that feeding your baby is an individualized decision, and we are here to support you in any way that we can.